Hello there. Now let's talk about the required testing before bariatric surgery, which is sometimes a long, boring list. Still, it's very important to make sure you're in the best possible condition before you have major surgery. Some of the tests you'll undergo are required by your insurance company, some are required by your surgeon, some are required by your primary care physician, and some are required by the hospital where your surgery will take place. The first evaluation you will need is by a psychologist. Some questions the surgeon will want to be answered during this evaluation include: are you depressed? And if so, how seriously? How will you cope after the surgery? Will you be able to comply with post-op restrictions and instructions? What kind of support system will you have to help you after the surgery? A mental health professional who is familiar with weight loss surgery and with whom you connect is also a possible ally for your short-term and long-term recovery. Don't hesitate to find a therapist before your surgery who will be there for you to draw on in the weeks and months post-op. Recovering from surgery can be very stressful, so it's great to have someone to support you along the way. Also, most practices will require a nutritional evaluation. A dietitian will identify the type of eating behavior you have and will instruct you on the major changes you must make after the surgery. Dietitians are a very valuable source of information about what you can expect and how much food you can eat after surgery. And usually they have a wealth of information on what other patients have experienced with their diets. Cardiac testing is also sometimes required to ensure your heart is in a tip-top shape before surgery. Everyone usually will have an electrocardiogram, EKG, beforehand, and some other tests might include echocardiogram or a stress test. Lung problems are common in patients who suffer from obesity, so most patients will also have a few pulmonary tests before surgery. Most surgeons will screen for a condition called sleep apnea, which means that when you sleep, you actually stop breathing for a period of time. I know, very scary. The good news is this is something bariatric surgery can cure. Sleep apnea can be mild to severe, and it needs to be identified and treated before surgery. You might also be required to have a gallbladder ultrasound. As people lose weight rapidly, they can form gallstones, which can end up causing a blockage on one of the ducts, draining the bile from the gallbladder, causing significant pain and inflammation of the gallbladder. The ultrasound will reveal stones if they are present. Some surgeons will even offer gallbladder removal during weight loss surgery to prevent future problems. Also, some centers will require an upper gastrointestinal series, which is an advanced X-ray or an upper endoscopy, to evaluate your esophagus, stomach, and part of your small intestine. Personally, I prefer an upper endoscopy or EGD, which is done by a surgeon or a gastroenterologist by putting a camera down your throat to take a look at your esophagus, stomach, and the first part of your small intestine. This study is helpful to rule out a hiatal hernia or any inflammation or ulcers in your esophagus or stomach. If you have any ulcer or severe inflammation, your surgery may be delayed until the ulcer or inflammation is treated and healed. Also, if you have signs of severe acid reflux on EGD, you might want to consider having gastric bypass instead of sleeve gastrectomy. In short, your surgeon shouldn't be facing any surprises during surgery, so they need an accurate assessment of your condition, and this is what pre-operative testing is for. Make sense? Terrific. That's all you need to know about pre-operative testing. When you're ready, I'll catch you in our next lesson.